Why did I not get more hair density with my hair transplant?
People who undergo hair transplant want to have more hair that looks natural. Most people are aware of the pluggy look because of how the hairs look sparse and lack density. In surveys done of men after hair transplant surgery by professional organizations, 60% of hair transplant patients were disappointed in their hair density after surgery. I'll discuss why hair transplants have inherent limitations when it comes to hair density, as well as how we are able to achieve natural density improvement without surgery. I'm Dr. Amiya Prasad. I'm a diplomat of the American Board of Cosmetic Surgery and a fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in New York City and Long Island for over 25 years. I've performed hair transplant surgery throughout my career and have had the same challenges with achieving optimal density due to difficulties with graft survival. In 2011, we used a material called extracellular matrix by ACell to improve graft survival and donor area healing. In addition to significant improvement in graft survival and donor area healing, I was delighted to see that areas where hair was thinning and not transplanted had better coverage than the area that was actually transplanted. Inspired by this observation, I spent the next several years developing formulations of extracellular matrix with PRP customized to individual hair loss clinical profiles. People have been coming to us from around the world for years, and we created a standalone, non-surgical treatment system for male and female pattern hair loss, which we call Tricostem hair regeneration. This treatment has been so popular that we have opened the first Tricostem hair regeneration center in Vienna, Virginia, the first office outside of our two main locations in New York. The issue of limited hair density can best be understood by comparing natural hair density with hair density from a hair transplant. Natural hair density can range from 50 to 100 hairs per square centimeter in the scalp. Hair transplants cannot achieve this level of natural hair density, even if multiple hair transplants were to be performed. In surgery, a safe transplant density is basically limited to 20 grafts per square centimeter. The scalp's blood supply cannot sustain any more than this number, nor can the skin tolerate greater numbers of stabs into the skin without the skin integrity becoming no longer viable. This means that grafts get lost and the donor area is limited, so these grafts cannot be readily replaced. Another limitation of hair transplant surgery is that when hair grafts are placed near existing hairs, there can be irreversible damage to the existing hairs, resulting in more native hair loss. This is referred to as collateral damage and further makes achieving natural density even less likely. My professional shifting away from surgical hair transplant to Tricostem hair regeneration is based on this simple principle. Hair loss is not solved by a hair transplant. Hair loss should be managed strategically with every modality available. Apart from an individual who has significant frontal balding, in my experience, most people considering hair transplant are better candidates for Tricostem hair regeneration as a part of their hair loss treatment strategy. I help many people save time and the expense of hair transplant surgery with Tricostem hair regeneration. With a typical 2-year treatment plan, a Tricostem hair regeneration patient will usually only need 1 to 2 treatment sessions 18 months apart to thicken thinning hair and stimulate growth of dormant hair follicles which already exist with natural density. Our results generally exceed the benefits of 2 hair transplant surgeries in terms of coverage as a function of hair thickness and density. I hope you found this information helpful, and thank you for your question.